Grüezi ragazzi, willkommen e bienvenue to Cannabis Scienza's LinkedIn Live for this week. To those of you joining us live, thank you very much for being here with us. And for those of you who will be checking out the recording at a later time, also thank you to you for checking us out. We hope you enjoy it. We hope that you perhaps even leave the session having learned something new today. We have a very interesting topic lined up with some guests we are very excited to introduce to you. Just a quick word about Cannabis Scienza. Cannabis Scienza aims to combat the bottlenecks of the medical cannabis industry using the power of education and through the training of healthcare professionals on the effective use of cannabinoid medicines. In doing so, we believe we are doing our part to increasing access for patients around the world. Patients with two legs, perhaps also patients with four legs, which is the topic of today's discussion. So if you haven't already, please head over to the Cannabis Scienza LinkedIn page, give us a follow. If you like what you're hearing today, give us a like. And if you have any questions, please hop into the comments. Today, we will be discussing the role of medical cannabis in the field of veterinary medicine. And I'm going to pass it on over to my colleague and the CSO of Cannabis Scienza, Fabio Turco, for a quick introduction to himself, and then pass it on to our lovely guests today, Elena Battaglia and Heidi Whitman. Thank you.
Okay, thank you, Bijan. Good afternoon to everyone, and welcome to this Cannabis Scienza live on LinkedIn. Our topic today is medical cannabis in veterinary medicine. And we believe this is an extremely relevant topic because in the last few years, a lot of studies, clinical cases, but also anecdotal reports have demonstrated the benefit of medical cannabis in treating veterinary pathologies. So today we want to dig deeper into this topic to explore how cannabis could be useful in veterinary medicine. Before starting, I would like to invite our guests, Heidi Whitman and Elena Battaglia, to introduce themselves. So please, Heidi, let's start with you.
Thank you so much, Fabio. No, it's a pleasure to be here. My name is Heidi Whitman. I'm a global strategist for Swiss Cannavitions, which is based in Zurich. My background as a veterinary technician stems back to about 30 years from now, and I have been working in animal health and wellness and introducing the cannabis side of it since for about 30 years. In 2017, I dove into the cannabis space to see what kind of options I could create as alternative and complementary medicines for animals.
Okay, thank you, Heidi. And the same with Elena. Can you introduce yourself?
Hi, my name is Elena Battaglia. I'm a vet. I've been a vet since 1996. And since 2016, I've been in the cannabis, diciamo, treatment. I racked up pretty much more than 3,000 patients in these last years, and both small animals and a few strange animals like chimpanzee from a zoo in Spain.
Oh, that's very nice. And so let's start with the first question for you, Elena. Why cannabis in veterinary? Do we need more medication for animals and pets?
Well, the first answer is like a question. Why not? I mean, we always need more medication if it's better for the animal, if it gives us less collateral effects, if it can help us with their body, like our body, because cannabis and CBD is not a normal drug. It acts on the endocannabinoid system, and so it tends to fix what is out of place. Okay, so I think that this medication should not be compared to everything else. It's like a step up.
Okay, thank you. And the same question to you, Heidi. Why cannabis in veterinary, and also in what pathology or condition has medical cannabis shown the most promising results?
Sure. Well, I support Elena in everything she just said. We need alternatives and complementary solutions using plant-based medicines. I think this supplement should be an option for all, and chronic and acute patients both deserve to have educated professionals provide these viable options. So first, we need the innovation, acceptance, and of course, the research to help support our veterinary professionals to have a blanket approach to the prescribing cascade where we can look at both sides of the spectrum with pharmaceuticals and plant medicines. And there have been a lot of studies focused on osteoarthritis, most of all, in canines. But like Elena said, there is an endocannabinoid system in many different species of animals. And I'm hoping that there will be movements now to have research on the various species to help with the acceptance of integrating veterinary medicine to have medical cannabis as one of the options.
Yes, how you said, we have an endocannabinoid system almost in all kind of animals. But when it comes with medical cannabis, we need to distinguish between pets and livestock animals, because regulation are different between the two kinds of animals. So, Elena, please, would you like to explain the difference to our audience between livestock animals and pets when it comes with medical cannabis?
Well, right now we can't use medical cannabis in livestock. That because if it's animals that are destined for meat and milk, we could have the cannabis residue in the milk and the meat. So mostly right now we are using it in cats and dogs, or if there are animals that are like in farms that aren't destined to become food.
Yes, so we can use medical cannabis just with pets now with the regulation in Europe, but I think also around the world. So, Heidi, can you tell us something about your real-world experience with the medical cannabis in treating animals? What kind of animals you treat with the medical cannabis the most?
Okay, this is a big question because I've been working not as a veterinary professional, but as someone that supports veterinarians and other groups such as animal sanctuaries and personal owners of pets over the past 7 years. And of course, small animals is something where we've seen a lot of positive results where, again, when you're dealing with an animal that's in pain, the animal in pain is not usually eating. Therefore, there's anorexia because of the pain. And if you can relieve that in a natural manner by giving a CBD product, a CBD or 20-to-1 product, even with some THC in it, you'll see the animal start to eat. And of course, their quality of life becomes better. So we've seen a lot of results like that with dogs and cats, mostly dogs. Now with horses, I'm an equestrian. I own my own horses. And of course, those were my first guinea pigs when working with cannabis. And I found incredible results when it came to their mobility. So I have an elderly horse, a senior horse who's 31, and he used to depend on bute, which is a common aspirin-like drug for animals with chronic osteoarthritis. And we have been able to maintain him with just CBD at this stage. And of course, through my adventures, like Elena, we've had different animals. I was working in Colombia in the country with a zoo in Cali, and they were utilizing cannabis on everything from electric eels to bears to the only hyena in South America who had osteoarthritis. But again, the ECS is in all of these animals. So when you're creating homeostasis with the introduction of phytocannabinoids, you can see the results quite easily, as animals are truth tellers and they're honest. So they will either be lame or not lame, or they will be pacing, and with a nervous energy, or not pacing. And it was really wonderful to be able to see it utilized in all those different realms.
That's very interesting. And you mentioned CBD, but you use pure CBD, or you prefer use medical cannabis rich in CBD?
I used everything from an isolate-based tincture all the way through to full spectrum. And in addition to working with a veterinarian out of California who was using a 20-to-1, which is, CBD to THC. So there was up to 1% THC in some of the products that we utilized.
Okay, thank you. And Elena, which is your real-world experience with medical cannabis, and which kind of animals, which kind of pathology you treat the most with medical cannabis?
Well, I started with my dog. She was my first patient, and it started with a CBD that I bought in the United States because she had osteoarthritis and she couldn't stand up, and it started off from there. And then when I realized how much it worked, I just started prescribing CBD isolate to all the patients that needed it, because at that time that was the only thing that we could find in Italy. Later on, I was able to find CBD full spectrum, so I passed on to that because well, studies show that it works better, and I have to say it is true. And from then on, I went to using cannabis, so formulations that have THC in it. And right now, I'm using mostly cannabis for my patients. Mostly are either osteoarthritis patients or they're oncology patients. And what people need to understand and what veterinarians need to understand is that oncology patients should start cannabis right away. You shouldn't wait for the pain to set in. I mean, cannabis should be used to make the animal feel better right away and be able to deal with his at the same time in a better way.
Okay, so we can say that CBD, but also THC are the most used product for animals. But we know that there are also other phytocannabinoids that can give good results. So, Elena, do you think that there are other phytocannabinoids useful in veterinary medicine other
Absolutely.
than CBD and THC?
Well,
Which one?
I would point to CBG and I would point to CBDA, and because both of them have they both can help with pain. They both can help with epilepsy. CBG is awesome for gastrointestinal issues, for dermatosis. It works very well in animals that are anxious. So it's not much used, but I use it a lot because after I found out its potential, I try to put it where it needs to be put. So in epilepsy patients, older patients,
Yeah.
arthritis patients.
That's right, because we know that CBG show also promising results with humans, but we don't have a lot of data. So maybe your experience can add more value to and more data to our experience also with humans.
Fabio,
Heidi,
if I may ask
yeah,
a quick question
of course.
here. Apologies for interrupting. We have Christina who's been adding some comments in the comment section, and that actually sparked the thought. Something that we were discussing before we started the live, talking about the dosages from your guys' experience, and maybe also how the dosages compare between different species of animals, and maybe how your initial intuition is maybe not the right way to look at it. It's kind of what we were hinting towards. So perhaps you, either Heidi or Elena, either of you or both of you, can please provide some context on your experience in terms of the dosages?
Elena, do you want to take this one?
Okay, sure. I do not use CBD isolate right now. I don't like it. I don't trust it. I think it's like here, and full spectrum is like here. So I'm not using it. I have it added to formulations with THC, with cannabis, so I can have a 1-to-1 ratio. So that way, it's easier to give the formulation to the animals. So that's mostly why I use it. Other than that, I never do. Dosage, that's complicated. I usually start off with, because it totally depends, you know. In cats, it's like around 2.5 milligrams of CD twice a day. And then from 10 to 20 kilos, I usually use on 5 milligrams. twice a day. I mean, dogs, obviously. And then I just go on from there. So you can just do the math. And I do not start with 1 milligram kilo. I start with a lot less, because I found out that if you start with less, it usually works. So you don't have to start really high.
Yep.
I've had patients that with those dosages have those dosages for them have been beneficial. So I'd rather start really low and then just crank it up.
Okay, thank you. I have another question for you, for both of you. How do you give medical cannabis or CBD to animals? Do you mix with food? And when it comes with the CBD, do you have experienced any side effects with the animals?
Do you want me to go? I get, okay. Just on my what I've done in the past is I've used an oral tincture, and ideally directly into the mucous membrane of the animal, usually after a high-fat meal of some sort, just to help with the absorption. That would be, say, with dogs, or when you're dealing with, exotic species or zoo animals. They were using little meatballs, and putting it in there but then you look at bioavailability sometimes being a little bit not so precise, because they're not getting it directly into their mucous membrane. But there's also discussion whether that is identified as the best means of giving it to animals. It's still up for discussion. And then with the horses, I worked in the past with pellets, so it was given as a supplement in their food. But CBD is not allowed in food because it is considered a drug in many areas of the world. But that's how we gave it. And in cats, I think oils are also a little challenging at times, depending on your cat's mentality and behavior. But if you can get it, I think, directly into their mouths, it usually works best.
Okay, thank you. You know that when it comes to medical cannabis, especially for humans, we often find as Cannabiscientia that there is a lack of knowledge, not only among the general public, but also among the healthcare professionals. Do veterinarians face the same problem? Elena, maybe you can ask. You can answer.
Sure. Well, yeah. Lots of vets still consider cannabis useful just for pain. So, like I was saying, for oncology patients, they will just tell the people that, oh no, it's too early, you don't need it yet, and they just wait for like the last minute to tell them they can use cannabis. So I think that's insane. And many vets don't even know the difference between CBD and cannabis. Patients of mine go to other vets, they're saying that, they're using cannabis, and these vets, they're like, oh yeah, CBD. Like, no, it's not CBD, there's THC. And they're like, and the vets would say something like, oh, THC, oh, you can't give THC to animals, it's dangerous. So we still have many veterinarians that still believe the stigma of cannabis, and they still believe that animals should not be put on THC. And I think it's terrible, because we're limiting the number of animals that could use it and could feel better. I've had an experience like a few days back of this lady that, she's like, oh no, they told me, my vet told me, absolutely, it's dangerous, it's psychoactive, I can't give it to my dog. I'm like, I'm sorry for your dog, because these people they won't understand that it's totally different. It's a plant, it's not dangerous, and they're used to giving drugs that have, a list of contraindications that are long, like a meter long, and that's okay because they're used to it. And then they get scared, they're giving THC to their animal.
Yeah. The stigma around cannabis is always present, both with humans and with animals, and we would like to overcome this issue. And regarding this, Heidi, what do you think we need to improve the knowledge and to break down the stigma around medical cannabis in veterinary medicine?
I could speak about this forever, but in a quick summary, what we need to do first and foremost is create an educational pathway. Right now, toxicology is where veterinarians learn about cannabis in most veterinary university programs. That's it. So we need to find a way to incorporate the ECS, understanding the applied theories in practice for the veterinarians. But coupled with that, we need research. So I support a group called Pet Pharma UK, which is led by Dr. Gary Richter. And one of the things that they're on a quest to do is to provide the research in regional territories. So right now we're focused on the UK to hopefully give the scientific backed product to the Veterinary Medicines Directorate to take a look at, to see if we can incorporate this into the veterinary prescribing cascades here. And I think it's these little steps that need to be taken across the globe to get the language to be one, to get the understanding to be understood from everyone, from every aspect of the animal health and wellness industry. And then we can allow these methodologies to come into practice. But guidance from the veterinarians is expected. They are the pillars of our community. And in order to get the consumers and the patients what they need, we need to make sure there's an education component that is infused into regional veterinary groups. And hopefully that is what is being enacted with so much interest in improving the education. But like Elena said, the understanding needs, the stigma is still there. It was there with humans, and it's just taking a little bit longer on the animal side. But with the group that I work with at Swiss Cannovations, we're on a mission to spearhead this and support groups like Pet Pharma to support anybody that's interested in improving animal health and wellness options. And hopefully with today's example, it's going to be discussed more and the pressure will be on to have something come to fruition.
Yeah. Let's hope that the stigma on cannabis will be down as soon as possible. And regarding this, we at Cannabis Scientia, we are planning to publish an handbook of cannabinology dedicated to veterinary medicine, in which we will discuss about all the field regarding medical cannabis, what is the plant, then the cannabinoid system in animals. And also we plan to put some insight from veterinary to discuss the real world experience as we are doing about treating pets with medical cannabis. And regarding, let's go to another aspect, maybe not so exciting, that is the legal aspect. We know that there are different regulations among the different countries in Europe. And can you tell us something, if you know, how is regulated now the market on medical cannabis in Europe? Which kind of products are allowed? I don't know who want to answer this.
Heidi. That's Heidi.
I know a little bit. I'm not the expert, but I can tell you I've been in it long enough to know what is not allowed, simply because I tried and tested many theories. Right now, CBD is not permitted, and I'm here based in the UK, and I work in Switzerland with the European Union quite nearby. CBD is technically not allowed. It is technically governed by the Veterinary Medicines Directorate, which states that this is a drug that needs to be prescribed by veterinarians only. And there has been no marketing authorization for CBD for pets in the EU or the UK. However, there are plenty of products out there that are being sold for pets. And there is that gray market, which kind of hovers over the United States. It hovers over here in this regard. I believe that this legal situation is going to improve. I think that with the research that's coming into play, with the fact that there are licenses now being granted for the black market versus, or no, I guess it would be black market, but not the gray market, the white market, for products to go into stores, I think things are going to start to improve because the research is coming in. And like I said, the regional research is going to help support maybe some legal changes that are going to happen. I do believe that in the next year to 2 years, we're going to see a change in regulation and some allowances that have not been in place. We do test on animals for the use in humans, and we don't allow it for animals. And I'm trying to figure out why and how we can fix this problem. So that is the technical part, is that it is considered a drug. So we cannot give it to our pets unless a veterinarian says yes. And then there's a lot of mystery of what product you should actually use. So let's hope we can define that, and our next conversation we have with you guys will have an answer.
Yeah, of course, let's hope that in the near future things will change regarding animals, but also regarding humans for the spread of medical cannabis in medicine, we can say in medicine. Okay, so we are almost at the end of this talk. Elena, is there a particular project you are currently working on that you would like to share with us?
Yeah. We're gonna come out with a full spectrum that's gonna be pretty special. It's gonna be 3 types: one for epilepsy, one for anxious animals, or with similar problems, and the other one for pain. And they're not gonna be like your normal full spectrum. We're gonna have CBDA, CBG. In the formulations, depending on the pathology, and the 2 or 3 terpenes for each formulation to make it more indicated. I mean, better for that pathology.
That's very interesting, especially the use of phytocannabinoids, because we know that also in humans there are a lot of experimentation going on to see if this product can be used in some kind of pathology, because they have a lot of potential. Maybe the difficulty is to stabilize the products, especially with the CBD acid, but if we can overcome this issue, I think we will have another drug available for the future, both for animals and for humans. And Heidi, maybe the last question also for you, the same question. Which are your projects for your future?
Well, I've had an ongoing project for many years, and I'm very grateful to be around groups that are supportive of it. But to back up what Elena said, she's coming out with products. I'm hoping to get an educational pathway, like I mentioned, with groups like Pet Pharma UK, the Veterinary Cannabis Society, the VetCan organization, all whilst I'm in my position at Swiss Cannovations, because we are trying to once again spearhead some of the educational pathways, and teaming up with your group is so helpful for this. But at the same time, we're also looking at how we can support the research, which will follow the education, and then provide product with our APIs in order to provide the best products for the animal market. Educating everyone from the customs agents to the retailer to the veterinarian is very important. And so that is what I've been working on, and that is what I will continue to do to allow animals to have exactly what they need.
Guys,
okay.
One quick question before we wrap up, and I think we touched on this earlier in the call, but I was asked this also by a friend who has a couple cats, and I know there is no exact answer, but perhaps you can just quickly perhaps touch on if you have a pet that has an ailment, such as, for example, arthritis, and you begin to give your pet some form of whatever the appropriate substance is, CBD or an isolate or a full spectrum. From your experience, how long did it take to see some improvement in the movements of the patient, let's say?
Okay, I'll answer with my experience.
Yeah.
Usually it takes a couple of weeks. I usually start off with a minimum dose, give it for 2 weeks, wait for it to start having effect, and then after 2 weeks I reconsider if he's okay or if he needs to add more. So some are feeling better already after 2 weeks. Some need more time to find the right dose.
Thank you.
Okay, thank you, Elena.
Heidi,
Bijan, you want to add
anything to that, Heidi, or?
Oh, well, I've had all kinds of different results, but similar to Elena. But real quick, I've had a dog with epilepsy who's sitting behind me right now. And during his seizures, I was able to apply tincture to his gums, and it reversed the fit. It reversed the seizure, and I got my dog back quicker. Wow. And then I started using it prophylactically after that with the veterinarian's guidance. So we are seizure-free now for 3 years. So it does work in different ways. It depends on the animal's weight, metabolism, ailment.
Yeah. Of course. Well, thank you very much for sharing your experiences. And Fabio, if you'd like to make some closing remarks.
Yeah, well, just to thanks Elena and Heidi to be with us to this very interesting topic, talk to my opinion. And so I would like to say goodbye to everyone and see you next week with our live.
Yes.
Thank you so much for having
Bye.
us.
Thank you very much for joining us. And everybody, keep your eyes open. We will be also providing some educational insights and resources for the use of cannabinoid medicine in the veterinary field. Thank you very much, guys, and thank you to everybody that tuned in.
Thank you, guys.
Bye.
Have a
Goodbye.
great evening. Bye.
Bye.
And cut.